Hello and welcome. You're watching Trending Tech on NewsX World, where we bring you the latest trends, gadgets, and tech breakthroughs from around the world. AI in healthcare is rapidly reshaping global medical systems. Hospitals, research centers, and tech companies. They are investing heavily in advanced algorithms to boost diagnostic accuracy, personalized treatment, and reduce operational burdens. Powered by machine learning and massive medical data sets, these tools can analyze scans in seconds and accelerate drug discovery. Governments are testing pilot programs, private sector innovation is surging, and major health systems are adopting AI-driven workflows. Momentum is strong, however, full integration faces significant ethical, regulatory, and privacy challenges that must be overcome before AI can safely and reliably transform patient care at scale. To talk about this, joining us now is Mr. Kerry Lay. Kerry Lay Miller. He's a CEO and founder of IDA Ventures. Her 8 years at Goldman Sachs has sharpened her expertise in technology, strategy, talent strategy, and mergers and acquisitions as well. Kerry is a regular speaker on topics including AI, blockchain, network, and incentive design. Thank you for joining us today. Welcome to NewsX World, Ms. Kerry. My first question to you is, what does AI in healthcare truly mean today?
Sure, and thank you so much for having me today. At the end of the day, it means a lot. When you first hear about AI in healthcare, many think it's robots replacing doctors, and that's definitely not the reality. It really is about better tools, it's about better diagnostics, early signs of prediction, and less time for paperwork. In India, for example, Apollo Hospitals uses AI to spot early signs of heart disease. Really important, as India has a really high rate of cardiac burdens. In the US, for example, the Mayo Clinic, a top clinic in the US, they use AI to predict complications before they happen. So it's not replacing medicine, it's really making healthcare smarter, faster, and really helping with patient care and operations.
Right, and where have you seen AI make the biggest impact so far?
Sure, I mean, I'd say at the end of the day, it's diagnostics. There's so many tools, for an example, for tuberculosis, TB, lung infections. So I'd say diagnostics, but really at the end of the day, patient care operations. It allows remote monitoring, operations. As many of you know, you go to the hospital, you go to the doctor, you sign forms, you wait for a while, and AI is really strengthening the entire ecosystem and the patient experience as well.
Right, and we often hear about AI reading scans faster than humans. What is the single biggest verifiable breakthrough where AI has recently improved diagnostic accuracy or early detection rates?
Sure, I mean, one that I think offhand, because I definitely have some family and friends who've had strokes, and one of the meaningful things is stroke detection. The CT scan and alert really within minutes of the stroke instead of nearly an hour. And just that time difference really determines what the long-term impact of strokes can be and the long-term disability. Another example in India, chest x-rays in communities without fast access to diagnostics, including rural areas. And then the last one I'll say, there's an emergency group in Israel, the United Hatzalah, and they are able to map out and understand where emergencies are likely to occur based on patterns like day, traffic, and past calls. It's not really about predicting the future. It's just a tool that really can help medics really reach people in a faster way.
And lastly, how is AI helping researchers invent new medicines much faster than before? What do you think?
Sure, and this is definitely one of the most exciting use cases and shifts that's happening today. It's really allowing drug discovery from years to months. There's biotech groups using AI to diagnose um, or design drugs in 18 months when it would traditionally take 5 to 7 years. In India, researchers are using the AI to map drug targets early and eliminate weak candidates before all these trials. As you know, trials can take a long time, illnesses develop quickly, and being able to have AI in the technology. I will say that just as relevant as the AI, the compute layer behind the scenes is definitely as relevant. There's a company that I'm involved with, Quamcore. They provide the advanced computing engines that allow these massive models. These models require a lot of energy, and the compute time is very quickly. And so, in order to have the molecule stimulations to image analysis to run safely and real time, you're also longer term needing something called quantum computing. And a company, like I said, that I've worked with, Quamcore, is doing this. So I'd say at the end of the day, these scientists are in no way replaced. They're supercharged, and to be able to get them that information in a quicker manner can therefore allow them to help patients also in a more efficient way.
And you highlighted that scientists are in no way replaced, but will AI enhance doctors' abilities or replace some of their roles?
Yeah, it's a great question, and so many people are looking at this.
Right.
I think at the end of the day, like I mentioned, it's going to enhance doctors. Medicine, there's a huge component that's human. People need that empathy. They need like the additional context, and they need that reassurance that a machine can't give. Doctors can give that. AI really helps with those repetitive tasks from reading the scans, writing the notes, and predicting the risk. And look, that frees doctors to focus on that human element, which sometimes can feel really rushed. Back to the operational side, by the time we get to the doctor, we've already spent hours, filling out paperwork and doing things. And that coupled with the idea that the doctors can show that human relationship. At the end of the day, doctors are really using it not to lose their relevance, really to actually make them more effective.
100%. I really like how you highlighted, the emotional need as a patient or even as humans that we need doctors for. And now medical records are the most sensitive data there is. And what is the one key technology that makes sure a hospital can use patient data to train AI without actually exposing anyone's private health information?
Yeah, I mean, look, I think that's really what the secret sauce is, and so many people are, and scientists and AI programmers are trying to figure out right now. Encryption is definitely something that across the board, it's not in healthcare only, it's across in data security right now, and in Israel right now, actually, and leader in cybersecurity. However, every country is looking at for this, every company is looking for this, and it is personally, it's scary, especially right now. It's protective, but in the future, technologies need to be developed in order to make sure that that it is secure. Also, another thing just to note is AI is a learning system. It learns from the data, so the data might be biased or limited, and results might be inaccurate. How many times do we use AI, ChatGPT, or other tools where it's not right? I have to confirm a couple times on occasion where my gut says this isn't right, and when I put it in, they say yes, that's true. So one from the accuracy and biases, one from the private and security, and at the end of the day, it is about human insights and oversight. So back to the safety, et cetera, and the critical results that are needed. It really is those three things that can make it safe and also powerful.
100%, yes. And Ms. Miller, looking now ahead, Looking at 5 years ahead from now, what is the most revolutionary futuristic use of an AI in healthcare that the average person should await?
Sure. I mean, there's several areas that I'm personally excited, and I know other doctors are excited. I mean, one thing is personalized medicine. We'll have tailored medicine for genetics, lifestyle, and real-time health data. There's a company I know, BioSense, that's able to track the microbiome data. So we really are getting to the entire ecosystem of your body and what you need as a person. So that personalized medicine, that AI-assisted home care. We're getting older, and what are the tools today to be able to help us get that hospital level monitoring really from their living room? And we're starting to see some AIs and advancements to do, that. The drug discovery, will be a lot faster. That is also just an area of criticality. And yeah, the emergency rooms being able and the emergency response is going to be able to be more predictive. So it's really, at the end of the day, it's not about replacing the healthcare system. It really is, how can we use this data to be more productive, more proactive, and then more accessible, and really more human. It's really elevating on each of those sides. So it's not just the data we're getting, it's the use cases of the data.
And lastly now, Ms. Miller, how might AI affect healthcare costs and accessibility?
Yeah, great question.
Thank you.
I mean, at the end of the day, costs are going to go significantly lower, if you can imagine. Those needs on the human aspect are going to be, more critical, which is going to protect the doctors. But the diagnostic tools that are needed, the costs are going to go down over time. And then look, what was your second part of the question?
No, that was it. Yeah.
So I mean, look,
Oh, like the
will it
healthcare
replace-
costs and
it will bring costs down.
yeah, costs and
The
accessibility.
research is going to be able to happen, and yeah, I think it's an exciting thing that's happened right now.
Yeah. Yeah, you covered it all, like the cost and accessibility. That was it. With that, I would like to thank Ms. Carrie Leigh Miller for joining us. It's been a pleasure to having you on our tech show.
Thank you for the opportunity, and everyone be safe, healthy, and everything that AI is advancing for all of us.
Right. Thank you very much for emphasizing that again. With that, it's a wrap on this episode of The Trending Tech. For more tech updates and innovations, stay tuned to NewsX World.